So which of the following is the most appropriate next step in management of this patient? Let's see. So a 32-year-old G3P3 female presents to the emergency department with a fever of 39, lower abdominal pain, foul, smelling vaginal discharge 7 days after delivering her baby via C-section. On physical examination, her abdomen is tender to palpation in the lower quadrants, and there's purulent discharge from the incision site. Blood pressure is 95/60, pulse 110. What's the next step in management? So, fever, probably some kind of infection, lower abdominal pain, there's discharge, and then tenderness in the lower quadrants. And the big thing is you have discharge from the incision sites, which can happen after a C-section. So let's see. I think it's going to be you're going to treat with antibiotics, but there's two choices.
Okay.
Either IV fluid antibiotics or administer oral antibiotics. I think with her blood pressure being lower, that you would use IV fluids and antibiotics. So A.
Okay. Final answer. A is what we're going with.
Yeah.
Good. Yeah. So it's a way to think about this too, right? Is that diagnosis? What's your diagnosis here?
I don't know, some kind of postpartum infection.
Yeah, so postpartum infection, but you can have what is it called? Endometrial, like endometriitis, right? And also wound infection. Those are the two things you're thinking about. So this is relatively severe, right? So oral antibiotics, just remember that I always think about severity too. Oral antibiotics is kind of like, oh, this can be treated at home. You don't have to be in the hospital. But this, right? This is not good. Patient's already in the emergency room, right? She's hypotensive, she's probably septic, right? So you don't want to say, oh, you're good, take oral antibiotics, you'll be fine, right? So you want to give this person IV antibiotics and also give fluids too, because she's hypotensive, and then monitor like a hawk because she can get really, really septic, right?
Yeah.
So A is going to be a way better answer than C. But yeah, just always, in your mind, I want you to always start picking kind of what's the diagnosis, right? So it is an infection. I like that, but I want you to take it one step further and be like, oh, this is endometriitis or postpartum wound infection, one of those. Okay.
So the uh low blood pressure, do you think that's caused, like what is causing that? I guess, does it explain it kind of in there in the
Yeah. So the low blood pressure that she has is probably because she's septic,
okay.
right? So remember, when you're really, really sick, your body is going to be very, very dilated, inflamed, right, to try to fight off the infection, right? Infection will cause dilation of your peripheries, and then what's ending up happening is you're going to third space a lot, and then what's going to happen is your blood pressure is going to tank. So, okay, and obviously tachycardia is one of the criteria too, right? So.